My name is Debbie Knight and I'm Head of Nursing and Midwifery Education at Portsmouth Hospitals Trust. I really enjoy supporting people to be able to develop because it's part of the role that I have. And having a tool such as this gives the opportunity of enabling staff to understand a little bit about themselves and how they might be able to develop. Using it as yourself makes you realise the effort that you need to put in thinking about you, because in our real world and the jobs that we do, we are constantly thinking about others, particularly around patient-focusing roles and how we might engage others and support others and make sure it's safe. And we sometimes don't pay attention to ourselves. So when you go through it for yourself and you stop and think, do I do that as a leader? And then actually going then to be able to find out if people think that I do or not is really useful. So from that point of view, that self-reflection, critical thought about yourself is really good. The person that I had was a very skilled facilitator, and what we did was we looked at the issues that were concerning me in the job at the moment and how I might use the HLM to enable me to think about those differently. My personal outcomes on the short term were some key development areas of things that I was already doing quite well, but I could do better, and that was about storytelling and sharing the vision. So how did I construct where we were going for people? And from my point of view, one of the skills that I have is thinking about the longer term vision, but what I wasn't doing was articulating that in a way that the team could understand. So in the short term, that was really useful for me. Longer term now, looking back, I'm very clear about how we do that within my team. So we create visual tools, we talk about it, we have team meetings, and actually been able to establish that. So that's worked really well. I absolutely would recommend the tool. We have a clear process within Portsmouth Hospitals about who we would like to have go through the healthcare leadership model, and that's for our senior leaders. Saying that, there are staff out there, because I'm also a coach and a mentor to people, so depending on where people come to me in their progress and their development, we stop and think about what tools will be useful, and it's in that sort of capacity that I advocate using the healthcare leadership model.